And welcome back. Thom Hartmann here with you. And on the line with us is our old buddy Wendell Potter, the president of the Center for Health and Democracy, the president for Business Leaders for Healthcare Transformation, the founder of Tarbell.org, the author of two brilliant books, Deadly Spin and Nation on the Take. And in fact, there's a chapter in my new book, The Hidden History of American Healthcare, about Wendell Potter, a good guy and a terrible job. And that terrible job, of course, fronting for the health insurance industry, which he now is criticizing. What a wonderful, wonderful story about a really, truly great man. Wendell Potter, it's an honor to have you on the program. By the way, you can reach him by...
It's an honor to be back on.
Thank you. You can reach Wendell by Twitter at Wendell Potter, which is pretty straightforward. And Wendell, I'm looking at this headline from this, it's a piece in Raw Story. UnitedHealthcare aims to scare black women from seeking emergency care. Tell us what's going on here.
Well, United is particularly aggressive in trying to keep people from getting the care that they need. And one of the things they're doing, they announced a policy that they said they would delay, but I'm sure it'll be implemented, is retroactively reviewing claims of people who are enrolled in United Health plans. And those people went to the emergency room, and after reviewing the claims, United would decide whether or not it was a true emergency. And if they decided it was not, then they would refuse to pay for the care. So this is just an outrageous thing that will discourage more and more people from getting the care that they need, because people will be afraid, and rightfully so, that if United thinks that it wasn't enough of an emergency, they'll be stuck paying the entire bill.
So
this kind of nonsense really affects black people more than anybody else.
Right, because they're more likely to use the emergency room as their first stop for health care. Tragically, but it's which is almost a whole separate rant. But let me just be clear. Let me just understand this. If I was a person who had a UnitedHealthcare policy, whether I bought it through Obamacare, whether my employer provided it, or whether I was one of those poor suckers who signed up for Medicare Advantage, the privatized scam that pretends to be Medicare for people over 65, yep. And I got a UnitedHealthcare policy. And let's say last fall, before there was a vaccine, I got a sore throat and lost my sense of smell and started coughing and thought, oh my God, this could turn into death. And so I show up at the ER because that was basically the only place you could go for much of last year to get tested, and say, I think I might have COVID. They give me a test. They say, yep, you've got COVID, but you're not going to die. Why don't you're still pretty healthy, so why don't you go home and, let us know if it gets worse. And just that little, bounce off the ER room could, in some places, cost, what, $2,000, $5,000, $10,000 just for showing up? And so back in the day, back last year, my UnitedHealthcare policy paid for that because they said, oh, it's the emergency room. Okay, we'll pay for it. And now here we are in the middle of a year later, 2021, and you're telling me that UnitedHealthcare is going to send me a bill for a couple $1,000s saying, we decided we really didn't want to pay for this. You're going to have to pay us back. Is that what you're saying?
Well, it would work a little bit differently, but that's the same principle. They would send you a letter and saying, we are not going to cover any of the charges, and you would likely get a bill from the hospital and or the doctors, and you'd be on the hook to pay all of it, because United would say, nah, we don't think you were injured or sick enough. And just think about this. If you are someone and you think you might have symptoms of a heart attack, but you're not 100% sure, and you know that you're in United and they have this policy, there are going to be people who second guess and who say, well, I just am not going to go. So people are going to die if this is implemented. And also if you're a parent and a kid has a big fall or falls off their bike or gets in an accident or something, and you go to the hospital emergency room, and it's not as severe as it could have been or you thought it might have been, and United says, no, we're not going to pay for it because it wasn't an emergency. You could have waited and gone to your primary care doctor. That's what they want to do. And that is just another scheme to avoid paying for care that they need to cover.
Now, UnitedHealthcare is the 600-pound gorilla in the room. They're the largest of all these companies, and they're largely because of the deal that they cut with AARP years ago that turned AARP basically into an insurance sales organization, and UnitedHealthcare being their primary provider, or maybe their exclusive provider. But this kind of behavior of saying, you know, we're not going to pay, you know, if you have pains in your chest and you think it might be a heart attack, so you go to the ER. If you wake up in the morning dizzy and you fall over when you get out of bed and you think, oh my God, maybe I'm having a stroke, and you go to the ER and it turns out that you have an ear infection, you know, if something like that happens, these and you know and you think you're having a heart attack and you get to the ER and they say no, that's just indigestion, you've got a bad case of gas, and you know it's pressing on that part of your body and it makes you feel like your heart is having an attack or a panic attack or whatever. I mean, there's a number of well-known things that can cause symptoms that are strikingly like heart attacks, pulled a muscle even. Once you go to the ER and they say no, you're not going to die, at that point you still have the ER bill, but the health insurance companies are saying, no, we're not going to pay for this. But where I started with this, United is the 600-pound gorilla. What about Aetna and Cigna and all these other companies that are smaller but still consequential in this field?
Well, you know, it wasn't the first company to come up with this scheme. Anthem, which owns and operates a lot of Blue Cross plans around the country, and I think a lot of people think Blue Cross plans are nonprofits, but a whole lot of them are for-profit and part of the Anthem family of companies. Another, it's the second largest behind United in terms of membership. You can be certain that Cigna and Aetna and Humana and the other big companies would follow suit because they look to these leaders to set the policy, and then they feel they have no alternative, frankly, but to follow suit. That's the way the insurance game works.
Amazing. We're talking with Wendell Potter, the president of the Center for Health and Democracy, the president of Business Leaders for Healthcare Transformation, the founder of Tarbell.org, author of Deadly Spin and Nation on the Take, Wendell Potter on Twitter. Wendell, if this is slightly off topic, but it's a question that I get asked on the air constantly. If you are one of those people who fell for those, I'm forgetting the sports figure's name, but I can see his face. You know, the guy.
Joe Namath.
Joe Namath, thank you. I wanted to say Joe DiMaggio, and I knew he's been dead for a long time. Yeah, where Joe Namath is out there going, you need to call right now the Medicare helpline, and we'll hook you. If you're one of those people who fell for that sales pitch from the for-profit insurance industry and left Medicare and signed up with the so-called Medicare Advantage, which is not Medicare, it's privatized health insurance for people over 65, and you're stuck with one of these policies that could well blow up in your face and that may not pay for you if you go to the ER if you think you're having a problem, how do you get out of it? How do you get back to regular Medicare?
Well, you can do it, but there are some potential penalties if you sign up for a Medicare Advantage plan when you're eligible for traditional Medicare, as when most people do. If you are dissatisfied for whatever reason, you can go back, but it might be very difficult for you to be able to get a supplement policy to cover some of your out-of-pocket expenses, because then the underwriters get involved. If you sign up for traditional Medicare when you are first eligible, you don't have to go through that process. You can automatically get a Medicare supplement policy, and it's advisable to do that because there is no out-of-pocket cap on the traditional Medicare program. I hope Congress will address that in the reconciliation bill. But if you are in a Medicare Advantage plan, you have so many restrictions. Your network is smaller. You are subject to prior authorization requirements, sort of like what we're talking about here, except it's prior to getting your coverage instead of hoping you'll get coverage after the fact. And you also have out-of-pocket costs that can be exorbitant. And here's the other thing. And there was an article, just the most recent one of many. I think it was the OIG or one of the government entities was doing a study of disenrollment for Medicare Advantage, and that happens particularly when you get older and you need more intensive care. You might need rehab care in a skilled nursing facility for a while. The networks are often very, very skimpy. So what you have, and what this was documented by the government, is that people are at that point disenrolling from Medicare Advantage and go back into traditional Medicare, that is exactly what these companies want. They want you to go back to traditional Medicare when you get really sick. And of course, that is more of a financial burden to the traditional program. It's a real con game.
So what they're looking at is people who are 65 to 75 and saying, this is the sweet spot where all the money is, and we're going to rig these policies so that when people hit, 85, when they start actually consuming a lot of health care as they get toward the end of life, they're going to get so pissed off with us stopping or refusing to pay for everything that they'll just leave. But then when they leave, they find that the Medicare, the Medigap policies that fill in that 20% hole that the conservatives insisted be in Medicare back in 1967 because, hey, people have to have skin in the game, that those companies, it's a lot harder to get coverage from those companies at that point?
It is absolutely a lot harder. You have to go through underwriting, and if you've got a pre-existing condition, one or more, you may not get approved. They don't have to approve you. And if they do, they can charge you quite a bit of money.
Yeah, so the lesson to people who are listening here is when you turn 65, if you're under 65 and you're listening to my voice right now, when you turn 65, beware, do not. unless you're happy with, a private for-profit health insurance company making a huge profit off you and telling you, no, we're not going to pay your bills. Stick with regular, traditional Medicare and get a Medigap policy as opposed to Medicare Advantage.
Absolutely, and I'll be running out of time, but I would also encourage people to reach out to your member of Congress and encourage them to make sure that in this reconciliation bill that Congress will be taking up soon, that they absolutely improve the Medicare, traditional Medicare benefits to include dental, hearing, and vision, and also to put a cap on out-of-pocket spending.
I'm with you, and I think it's in the plan right now. I hope it stays. Wendell Potter. Wendell, what's the best website for people for all the work you're doing?
Wendell at wendellpotter.com, or as you mentioned, at Wendell Potter for my Twitter feed.
Okay, wendellpotter.com and at Wendell Potter on Twitter. Wendell, thank you so much for dropping by. It's always great talking with you.